Neuropathy can be hard to diagnose. If you were recently diagnosed with the painful condition and have questions, keep watching because Dr. Matt Thomas, board certified in neuropathy, and the 360 Neuropathy founder is here to answer some of the most commonly asked questions. Good morning. It's so good to see you again.
Hi, Jane. Thanks for having me back on Good Morning
Nice
Texas
to see you.
today.
Okay. First of all, just tell us, what are some of the most commonly asked questions about neuropathy?
I get a lot of questions in my office, and I'd say there are three that I probably get more than any other questions. The first is, how do you treat neuropathy? First, you have to come up with, an accurate diagnosis, and there are three things that typically have to happen. Most patients who have neuropathy have such a significant lack of blood flow, they're not getting enough oxygen and nutrients into the nerves. You've got to stimulate the nerves to grow, and most of these people are so nutrient deficient that there are certain nutritional deficiencies that have to be addressed. So, that's the first question I get. The second one is, can you help someone who's had neuropathy for years or even decades? And absolutely, but you have to catch it in time. Once someone gets past 85% sensory loss, it becomes very, very difficult to reverse the condition. So it's very important to get seen early so that we can completely reverse it. And the third question is, can I get off my medications with treatment? And isn't that the goal? So absolutely, Cymbalta, gabapentin, Lyrica, all of these heavy-duty prescription medications, they just mask and manage the symptoms. So as long as we get on top of this thing, you can get rid of the medications and get back to living a healthy life.
So you mentioned, I think it was 85%. How do you identify the amount of damage that's been done to the nerves?
Well, every new patient, we do a very thorough sensory examination to determine how much nerve damage there is. But I like to use thermal imaging in some of my exams as well. If you notice in pictures, you can see red. Red indicates blood flow and healthy tissue. So somebody who does not have neuropathy, that's what you're going to see. If you look at an image of someone who does have neuropathy, you're going to see a lack of blood flow in at the end of the toes and into the foot, and that's going to indicate tissue that has such little vascularity that those nerves are actually dying.
So I know that there are some people who have neuropathy in the hands. How do you go about treating neuropathy in the hands?
Well, neuropathy is ascending typically, unless it's coming from the spine. It goes to the feet, and then it comes up through the hands, and we treat it in a very similar way. And if you look at the pictures of the hands and the thermal imaging, you can see the lack of blood flow in someone who has neuropathy as opposed to someone who does not. It's very important to stimulate the nerves to grow, and we have at-home protocols as well as in-office protocols to correct the condition.